The pressure to replace Obamacare is on. Some conservatives, including Senator Ron Johnson of Wisconsin, are expressing concerns, saying the Senate bill doesn't repeal Obamacare or lower costs for Americans. Joining us now is Lieutenant Governor Rebecca Kleefisch of Wisconsin. Rebecca, your colleague, Governor Scott Walker, issued a statement before the bill was released encouraging state Republicans to keep their promises to replace Obamacare. Yet, Senator Ron Johnson, as we just heard, says, he's worried the Republican plan wouldn't actually repeal Obamacare. Do you agree, first off?
Well, I haven't read the United States Senate bill, but I will say this. Ron Johnson campaigned on repealing and replacing Obamacare. Well, my understanding of the senator's position is that he doesn't believe this bill does that. And if that is the case, then he wouldn't be fulfilling his campaign promise, because his eventual goal is to get rid of the Patient Protection and Affordable Care Act as we know it, because for folks like me, cancer survivors and people with pre-existing conditions, Obamacare is a threat. And what we have seen and heard is not yet the right solution. So I'm eager for the repeal and the replacement of Obamacare, but I think what Senator Johnson is looking for is the same thing Governor Walker is looking for, which is the right bullet to hit the right target, and that is the true repeal and replacement of legislation that would be devastating for people like me who are dealing with pre-existing conditions and also rising healthcare costs.
As the Lieutenant Governor, you're on Governor Walker's task force, if you will, to fight opioid abuse. Back in 2013, more people from Wisconsin died from a drug overdose than even a car accident, suicide, or firearms. What are you doing to stop the opioid crisis?
Well, we're very blessed in Wisconsin that we are regarded as a leader in fighting opioid abuse, but we know there's more that needs to be done. That's why the governor convened this task force on opioid abuse, and he said he wanted me to co-chair it along with a state representative colleague of mine whose daughter is dealing with addiction. It's really important that we stay ahead of the bad guys. And so one of the suggestions that my co-chairman and I made to the governor earlier this year was cracking down on the drug traffickers and adding 4 new positions to do that inside our Department of Justice. But in addition to cracking down on the traffickers, we also know that about 80% of those folks who get addicted start with a prescription. Whether it's their prescription or someone else's, we know that these are opioids that actually came at some point from a doctor writing a prescription for them. And if that's the case, we need to start to change our culture of prescribing. That's why in Wisconsin we've implemented a prescription drug monitoring program. So the prescribers, as well as the pharmacists, have access to a database of folks who have been prescribed these medications so they can detect when someone is pill shopping, when someone is either an addict or someone is looking around in order to pass these on to either the bad guys or someone they might get hooked on drugs. We know that very few people actually start with heroin itself, and so changing our prescribing practices, as this prescription drug monitoring program already has done, year over year there are about 14% fewer prescriptions, and so we know that that is big part of the solution.
And important work. Lieutenant Governor Rebecca Kleefisch of Wisconsin, thanks so much for talking with us.
My pleasure.